this is one of the beautiful things about the ThinkSmart platform, is that it's educating everybody and to help them not only understand how these different interventions work, but how they can personalize them for their own lifestyle, their own dietary preferences, their own goals. And because there's more than one way to access the benefits of these interventions. So I think that's really a wonderful thing.
At the 2024 Bazooki Group Metabolic Psychiatry Retreat, leading clinicians, researchers, and individuals with lived experience came together to advance the integration of metabolic therapies into mental health care. I had the honor of speaking with Dr. Georgia Ede, a Harvard-trained psychiatrist and leading voice in metabolic psychiatry. Through her clinical work, research, and advocacy, she's transforming our understanding of how nutrition impacts brain health, challenging conventional psychiatric approaches, and offering new hope for recovery. As someone who struggled with bipolar I disorder for years before finding healing through metabolic therapies, I know firsthand how life-changing these approaches can be. In this conversation, we explore Metabolic Mind's ThinkSmart framework and the role of metabolic strategies in reshaping mental health care. Let's hear from Dr. Ede as she shares her expertise on this groundbreaking approach to recovery.
Welcome to Metabolic Mind, a nonprofit initiative of Bazooki Group, transforming the study and treatment of mental disorders by exploring the connection between metabolism and brain health. Thank you for joining us on this journey.
Hi, Dr. Georgia Ede. I'm so excited to finally have a chance to sit down and talk to you today. Thanks for making time.
Thank you very much for inviting me, Hannah.
So I wanted to talk to you today about this amazing new metabolic mental health framework that we're launching called ThinkSmart. And the idea is that it is descriptive rather than prescriptive, and it's giving the lived experience community an opportunity to share their insights in terms of metabolic interventions that have helped them on their healing journeys, right? So first of all, I wanted to start with the think portion of the ThinkSmart model, which is therapeutic integration of nutritional ketosis. I was wondering if, from your perspective as a pioneering clinician in the field, how do you think ketogenic therapy is going to change the way that mental health care is treated?
I think it's already changing the way mental health is, the way we think about mental health conditions and the way we treat them, but also the way we feel about them. Because for so long, people have been told that, that the reason why they have a mental health issue is, maybe because they're genetically susceptible, something about their DNA, or some very real trauma occurred in their life that's caused some, deep psychological damage, or even damage to the brain that can't be easily repaired, and that may require long-term psychotherapy. Things, or some chemical imbalances, some mysterious chemical imbalances that would need to be addressed with medication. And so most people have really been led to believe that their mental health condition is kind of chronic and mysterious and potentially incurable. And in some cases, they've been led to believe that it may in some cases be their own fault, character deficit, weaknesses in their character, or that they're not trying hard enough. They haven't done enough to sort of pull themselves up by their bootstraps. And what we're understanding now, which is really a revolution in psychiatry, revolution in mental health, is that we now understand so much more about what's the underlying drivers are of mental health conditions, and so much of it has to do with brain metabolism. And the ketogenic diet is different than other diets because it energizes the brain differently. It really fundamentally changes the brain's operating system. And so it even goes beyond individual diagnoses, where really it almost doesn't matter what the diagnosis is. Because this is a healing metabolic intervention, it's good for the whole brain, and therefore no matter what is really bothering you, makes sense to consider in most cases as a step one. As long as you're not in an emergency situation, why not start there?
It is such a profound idea that it has really transformed our understanding of mental health. And as someone who personally got that kind of devastating message of, you have a lifelong chronic illness and you're never going to really go back to being the person that you thought you were before your diagnosis, it's crushing, right? And this is a message instead of hope and the potential for recovery and remission and long-term healing and really being able to live your full life again instead of feeling like you're just always going to be managing a chronic condition, usually with a lower quality of life and having to endure a bunch of negative side effects from medications for a lot of people, right?
Absolutely. So these interventions they're not just powerful, they're empowering. So really what people can do is if they understand how it works and this is one of the beautiful things about the THINK+SMART platform is that it's educating everybody and to help them not only understand how these different interventions work, but how they can personalize them for their own lifestyle, their own dietary preferences, their own goals. And because there's more than one way to access the benefits of these interventions. So I think that's really a wonderful thing. And as you were saying, from a patient perspective, from a lived experience perspective, you weren't told until recently that this was something that you might be able to do something about and actually aim for remission. It's the same for psychiatrists. I was never taught to aim for remission. I was never taught to expect recovery. That was not our goal. Our goal was stabilization, and usually at tremendous cost. Long-term psychotherapy, medications, often medications with very serious metabolic side effects that take years off of people's lives, reduce their quality of lives, cause all kinds of weight gain and sexual side effects and blunting of emotions, all kinds of things that make people feel worse. And that's a difficult decision for people to make. Should I take this medicine, which is going to make me feel worse in these other ways in order to feel better in these ways? That's a pretty difficult decision to make. And now we know that if you're open to thinking about it differently, THINK, if you're open to thinking about it differently and trying these interventions, then a completely different path may be open to you. Your life may change in ways you would never expect.
Yeah, absolutely. It's really an incredible paradigm shift. And as you mentioned, so empowering to patients. And I love the idea that people can go and just see the wide variety of interventions that people are using and how they're working for them, because there's so many different ways to go about improving metabolism and so many potential interventions that people can try that will really help optimize their mental health and lead to great outcomes. So I'd love to hear more of your thoughts of the SMART model overall.
Yeah, so what I love about the SMART model is that there are many different ways to improve your metabolic health. And so it's not just about diet, although diet is fundamental. It's about movement. It's about circadian rhythm. It's about changing some other habits in your life and in many cases, unfortunately, letting go of some things that lots of people think of as normal parts of life, things like drinking alcohol or smoking or spending time in relationships that may not be good for you or taking in too much negative information, like really improving all these aspects of your life so that you're taking care of yourself in a really deep and fundamental way to improve all aspects of your health. So for a lot of people, when they change their diet, a lot of good things happen. But in many cases, it's not sufficient on its own without these other pieces. You really want to take good care of you want to pay attention to all of these other aspects of your life as well. And this is true not just for people who have a diagnosed mental health condition, it's true for all of us. So all of us should be aiming for optimal mental health. And most of us don't have optimal mental health, even if we're not diagnosed with a mental health condition. But for people who have been diagnosed with a serious mental health condition, it's especially important to pay extra attention to all of these different pieces. So what do you track? How important is exercise? How can you restructure your life in a way that prioritizes optimal brain health?
Yeah, absolutely. And I think it's incredible that I get the privilege of meeting with so many people who have lived experience putting a condition into remission. So we heard from Harmony Bright in our lived experience panel, who suffered with debilitating schizophrenia symptoms for 16 years. And everything that she's done to implement these metabolic therapies and completely transform her health and her life, she speaks with so much insight, and now she's advising so many friends who've never had serious mental illness on things that they can do to optimize their mental health. So it's almost just one of these great examples of post-traumatic growth and how people, once they master these models, these are relevant whether you have serious mental illness or whether you're just an ordinary person trying to optimize your brain health, right?
That's right.
Kind of a spectrum. I wanted to ask you in a little more depth about the avoid aspect of this model, which you touched on, that there's often, especially with serious mental illness, a lot of people maybe have self-medicating tendencies. I struggled with that. I know a lot of others do as well. So starting to cut out things like alcohol and smoking, and that can be a real challenge for some people.
It really can. So for many of us, think it's perfectly normal to have caffeine in the morning, to have a glass of wine in the evening, and there you can even find studies that will support those habits. Although they're really very poor quality studies. I wouldn't recommend that you live your life that way. But really, when we look at these simpler, what seem to be benign, a cup of coffee in the morning, a glass of wine with dinner a few times a week, even those types of habits can, for some people, make a real difference in really be taking a toll on their mental health. And so one of the things I really like to do in my practice is ask people about their caffeine use and ask them about their alcohol use. But before we talk about some of the downsides, I always ask, okay, what is that doing for you? Like, what are the good things that it does for you? Because people aren't stupid. They do things for a reason. So, and then we try to get to, okay, why is it that you feel tired in the morning and that you feel you need that caffeine boost? Or why is it that at the end of the day, you're feeling edgy or anxious or can't settle? And then you might reach for a glass of wine, because even people without serious mental health conditions, a lot of us are all self-medicating in these ways, and trying to wake ourselves up in the morning and trying to calm ourselves down in the evening. And so what is that about? And what I've noticed is that using ketogenic therapies in my work is that for the people who are willing to explore their relationship with these substances, if they follow a really well-formulated ketogenic diet, get into good sustained ketosis, and start to recover, and those imbalances in energy and anxiety that happen throughout the day that we think of as normal, they go away. And so you wake up with energy and you feel calm even at the end of the day. You don't need to pick me up at 2:00 a couple of hours after lunch because your lunch hasn't put you to sleep. So all of these things, I try to pull these things together with people so they can see the connections and explore for themselves. And the THINK+SMART platform is so beautiful because it encourages and inspires people to really adopt a curiosity mindset, explore, experiment, find what works best for you. Some people may do just fine with a cup of coffee in the morning. Other people may feel it makes them anxious or that it interferes with their sleep. Other people may do fine with a glass of wine a few times a week in the evening, and other people may find that it makes them depressed or unproductive the next morning, or that they feel anxious in the afternoon the next day, or that they start to think about the alcohol too much and want more. So lots of different I think it's really important to encourage people to explore and all of the different aspects of their lifestyle. And this removing of things, the avoidance of things, is not just avoiding substances that I think many people would say, okay, well, I can see that those are psychoactive substances. I might want to think about that. But even some foods, some of which we think are healthy, and I write about this in the book, are things that might be worth avoiding, at least as an experiment, to see how they're affecting mental health as well.
Absolutely. One thing I think that's also exciting about this model is how a lot of the areas are kind of interconnected. So what you were saying about someone needing to think why they're reaching for a certain substance, I think that ties into kind of the rebuild part of the model where we talk about things like mindfulness and journaling. And, definitely when someone starts ketogenic therapy, it can lead to that increase in energy and maybe they don't feel that added stress. But sometimes maybe there's still a life stressor or something happening, but you can encourage them, right, to reflect on what that really is instead of just, reaching for a glass of wine, really get to the underlying issue and think about how you might address it, right?
Exactly. These psychological tools, reflection, journaling, even psychotherapy, these are all still very useful. We don't want to throw the baby out with the bathwater, right? So the beautiful thing about using these metabolic interventions and sort of cleaning up the diet and improving brain health in these other ways is that it allows people, what I've seen in my practice over and over again, it allows people to make better use of and become more effective in their psychotherapy and in their reflections because they're feeling better, so they're feeling stronger, they're feeling more capable, more resilient, and more less vulnerable. So when they're exploring these deeper issues, they can, some people describe it to me as, well, I can now see things so much more clearly, and I see that I have more options, and I don't get as discouraged, so I make more progress, and I feel more capable of trying new things. So they make better use of therapy, they make more progress in therapy, and in many cases, I have to say, they don't need therapy for as long as they would have otherwise needed it.
Yes, absolutely. And I think it's interesting because sometimes people claim that our field positions ketogenic therapy as a panacea of sorts, but it couldn't be more far from the truth because I think most people are acknowledging ketogenic therapy is the first step, and then that's where you're able to do the deeper work and really find recovery. It's a lot that diet is enabling, but it's a lot more than that allows people to move forward in their lives.
Exactly. It's the foundation. It's the metabolic foundation, but it's certainly not the end of the road for most people. Most people need to do additional work, but when you have that foundation and your cells are feeling so much better, all of these other pieces become easier. Exercise becomes easier because you have more energy and you feel better about yourself. If I might tell a brief story, my mother, who's 91, has never really been an exercise person, but she started a truly ketogenic diet about 3.5 months ago. She used to spend a lot of time, sitting in a recliner, watching television. She would go and do her errands too, and she enjoyed getting out in the morning, but she's never been an exercise person per se. And just a few weeks ago, spontaneously, without anybody ever having recommended it, she just started exercising during commercial breaks of her favorite television shows. And she's now up to 7,000 steps per day.
That is such a great story. It looks like it took you a little while, even in your position, to convince your mom to try it, but at least you're finally successful.
Family members don't listen to each other.
That's very true. I've seen that in my life as well. So right before we started this interview, it was really great just hearing you and Harmony connect because she was talking about your advice and change your diet, change your mind to get a TSA approved cooler so that you can travel with ketogenic food. And that's just one really sweet example of how your book is influencing real people's lives. And I'm sure it's been incredible, to see directly the impact on patients, but the fact that now there's this whole movement that's growing exponentially and is scaling. It must feel incredible to connect with people like her and see the difference, that it's making.
It's just music to my ears when somebody writes to me or comes up to me and says, this particular piece of information in the book has really been helpful to me. Because my goal with the book was to put as much information as I could in the book, not just the science, and a lot of people find the science very useful, but the practical pieces too. And not just ketogenic diets, but paleo diets and carnivore diets and elimination diets. And and even single step improvements to dietary quality. I really wanted everybody to have a seat at the table, when it comes to, improving their mental health. So, and as I like to say, I'm nutritionally pro-choice. This is something that I think is relevant to our discussion, is that because you follow a particular style of ketogenic diet that I'll let you describe if you haven't already to people, but whether the fats and proteins in the diet come from plants or animals is irrelevant to the metabolic benefits of the diet. And so you can design the diet around your dietary preferences and your goals and tolerances. So that's a really common misconception about the ketogenic diet, is that it has to have red meat, or that it has to have dairy, that it has to have animal products at all. It doesn't. And so this is an equal opportunity intervention for anybody with a mental health problem, regardless of their dietary preferences, can explore the benefits of ketosis.
Thank you so much for sharing that. Interestingly, the THINK+SMART model has made me think a little differently about my decision in terms of being a vegetarian, because I am a vegetarian. It's not a moral judgment on anyone else. It was just as soon as I was old enough to realize meat was an animal and that I was eating an animal, I lost my appetite. I'm like, I'm never doing that again. And my parents thought it was going to be a phase, but I'm just turned 40 and I still haven't grown out of it. So I actually do believe it's likely more optimal in terms of physical health to eat meat. But at the same time, when you think about this comprehensive strategy with THINK+SMART, there's more to consider in terms of the how something might make you feel, or if it's, I describe it as somewhat spiritual, that I have this aversion to eating an animal. And I actually lived in India for many years, where we know a large portion of the population is actually vegetarian for spiritual reasons. Yes. So really you have to consider the whole person when you talk about nutritional choices in that respect. And I was thinking, well, even if I did decide to eat meat and got the nutritional benefits, would that be countered by some of the emotional, mental things in the SMART model, that would add to negative feelings and stress and stuff like that?
That's absolutely right. So everybody needs to decide what's most important to them. And so if we prescribe the same diet to everybody, we'll lose a lot of opportunities to help too many people. And so I think the personalization is key. Culturally, emotionally, spiritually, even sometimes practically or economically, following a particular style of ketogenic diet may not be accessible to everybody, or emotionally or spiritually comfortable for everybody. So that's, why I think you're such a great example in the community is, yes, you can. There's lots of different ways to do this. So I really appreciate what you're doing.
Absolutely. You too. Thank you so much. I loved hearing all of your insights, and it was great to get a chance to talk to you.